Hi, everybody. When I saw the lineup today and I thought, okay, I'm kind of closing things with all this health stuff and how is that going to be related to all the other talks, but I think what's been exciting is virtually every talk that you've seen so far really fits very well with what I'm going to talk about. So we saw examples of telescopes and imaging and putting ourselves under a microscope as part of one of the themes that I'll talk about. We heard about kinetics and motion, which from a cardiologist standpoint is a really important health activity. And then two other very important ones, food and alcohol, as we'll see, are actually part of what helps us stay healthy. So let me start. So with the science theme of our lives under a microscope, I'm going to talk about your heart under a microscope. And we'll get to the mobile health part, but I thought it'd be good to also talk about kind of the full perspective from imaging to mobile health. And I do have a couple of disclosures. I get some MRI research support from GE Healthcare, and I'm a voluntary advisor for OpenM Health, which I'll mention. So I think it's important that everybody gets up to speed on heart disease, and one of my goals whenever I give these talks is to help you learn more about it, so help you prevent you from getting it and not needing to see me. So what is heart disease? Well, the main form of heart disease is what we call plaque buildup that happens in your arteries. So it actually doesn't start in your heart, it starts in your blood vessel wall. And as you can see from the picture, you have these small arteries that feed your heart. And when they get a plaque buildup, it can form a blood clot. And then that blood clot, if the picture goes, can block off supply to your heart artery, and that can damage your heart muscles. That's what a heart attack is. Similarly, a blood clot that forms in a blood vessel in your neck can go up to your brain and block flow there and cause a stroke. So we have heart attack, brain attack, but it starts in your arteries, and that's what we need to worry about, how to try to keep those healthy. So who gets heart disease? Unfortunately, it's really, really common. So in a lifetime risk, so about half of all men and about a third of all women will develop heart disease or stroke. The good news in the US, it's declining. So all that research and all that work by the NIH and all the drugs and procedures that we have appears to be working. The bad news is we're exporting a lot of our unhealthy habits, which we'll start talking about, to the rest of the world. So if you look at what's happening in the world, it's already now the #1 cause of mortality worldwide, and it's only growing, particularly in middle and lower income countries where we're unfortunately exporting our kind of cheap, unhealthy food and more sedentary behavior. So what really causes heart disease? So what causes that plaque buildup? Well, we certainly talk about genes, and I'm sure people know there are families where you can get, where there's a history of having heart disease at an earlier age. So genes is one part of it, but a lot of studies show that it's really our behaviors and many modifiable behaviors that contribute to the majority of those who go on to develop heart attacks or strokes. And obviously, it's something that develops over as we get older, over time. And you can see here's an example, kind of a blown up view of a coronary artery where plaque is developing over many years. I also like to call this, so you can see on the side there's a little 1/10 of an inch problem. So our coronary arteries, while they kind of look big on the picture here, they're really only 2 or 3 millimeters. So it's really only 1/10 of an inch. So now you can see why a little bit of plaque buildup with a little bit of blood clot on top of it can make you go from feeling perfectly fine to having a heart attack. So again, a good news, bad news thing. most of the elements that contribute to those who are at risk for heart attack are quite preventable and modifiable. The problem is we're not so good at doing them. But notice from our earlier talks, so we have regular alcohol consumption is clearly helpful for your heart. Choosing foods wisely. So in many ways, maybe the solution to the cardiovascular disease is how do we modulate our food and the experiences around it so that we eat those healthier things and maybe not quite so much of the unhealthy stuff. And then regular exercise, probably the best medicine in the world, not only for heart disease, but for almost everything else. And then all the other risk factors that you probably more typically talk about, but all of these are modifiable based on our habits. So I mentioned the bad news. So in the US, these are fairly recent data that if you look at all the key elements that go into our risk for heart disease, on most of them we're doing about 50-50. Certainly on the healthy diet score, we're doing pretty poorly. So the net sum of this, less than 10% of the US population is what we would call kind of an optimal low risk for heart disease. So the part of that good news, bad news is I consider kind of the world's population as our patients. They don't have heart disease yet, but this is the time to start thinking about it and doing something about it. So let's take the next step and talk about the imaging. So we have this incredible technology now. So lots of different imaging techniques. This is an example of a CAT scan. So this can see down to about 0.5 millimeter. So you can get these beautiful 3D pictures. And then the arrow is pointing to an area where there's plaque. So you can see what looks like an area where the blood is flowing, but it's a bit narrowed, and then there are chunks of calcium there. So that tells us that there's plaque that's built up. So actually, calcium scanning is probably the best studied kind of risk tool that we have. The National Institutes of Health sponsored a very large trial, over 6,000 individuals. And if you can stay free from calcium in your coronaries, I just actually had one of these myself a couple of weeks ago, and I got a 0 score, which I was very happy about because that puts me at this bottom curve in terms of my risk of having a heart attack. But if your score is high, your risk is quite high. But where is imaging going? So a CAT scan gives us beautiful structural images, but really we'd like the microscope to go even farther down. Can we start picking up blood clots that have formed in the heart or in the plaque? Can we start imaging the biology? We heard about the yeast eating the glucose. Well, one of the imaging tools we use in PET scanning is we look for cells inside our plaques gobbling up glucose. The PET agent has been modified a little bit, so when it gobbles up the glucose, it's radioactively labeled, and it can't get rid of it, so it accumulates inside the cells. So you can see on the PET example, there for actually one of the faculty in our group, when he was a fellow at Mass General, did this study to pick up hot spots in patients who were coming in with heart attacks, finding spots where the cells were very active, inflamed, and eating up a lot of glucose. And the MRI picture you see has a little hot spot. In this one, this was picking up that there's a blood clot that's already forming inside a plaque, and this was indicative of very high risk of having a subsequent heart attack. And where is that going? Believe it or not, they figured out how to put a PET scanner and an MRI scanner into one machine. And so I think we have really, of course, a very expensive, but a very powerful technique that we're just starting to study, combining these two modalities to really understand the structure and the biology of plaques as they develop. So what is this term mobile health? So it's not this. So there is imaging in a truck, and unfortunately in some of the companies that do this and some of the institutions that sponsor it, there is a general recommendation not to just go out and screen everything and everyone. This should still really be guided by, there are guidelines for these things. So this is not the mobile health I'm talking about. The mobile health I'm talking about is really more all these devices and apps that have kind of flourished really just in the last few years, since all of us now carry around cell phones, and then there are all these devices on our wrist. So, some typical examples. It started with the activity bands, Nike, Jawbone, Fitbit, but now we're in the era of smart watches. It's still up in the air if people are really going to buy these, but they look pretty cool. And the question is, can we take this cool technology and turn it into something that can help your health? So yes, what is the point of mHealth or mobile health? Well, we really now have these apps or devices that can, in effect, image or put a microscope or a macroscope or whatever you want to call it on our activities and our health, what I call the other 362 days a year. So most of us go to the doctor maybe 3 times a year, but it's those other 362 days that really are determining our health, not the time we're in for a scan or not the time we're in to talk to our doctor. So it's these daily habits, which largely go unmeasured, that determine our risk for heart disease. So we really have the opportunity to change that, to actually measure these things, and then hopefully figure out a way to use that data to help ourselves and to help our patients. So I can put on both hats. I wear this to help myself, also to study how I might be able to use this to help patients. And so we really think this is an era where this will greatly empower patients to become much more aware of their own health and to be able to do things to improve it. And the hope is that physicians, clinicians can figure out how to integrate this into our care so that we really transform how we do care for your heart or medical care in general. Instead of these sporadic visits a few times a year, can we have it be more continuous care that promotes heart health, that's predictive, preventive, rather than just waiting till something comes wrong and taking care of you then? So one example, I mentioned this Open mHealth. It's a nonprofit foundation that's really trying to aggregate all this different mobile health data and bring it into a format that the physician could use and share with their patient in the clinic. And this is a fun picture because it's my mother-in-law, and she's sitting there with one of those kind of wireless blood pressure machines because she has had a stroke and she has high blood pressure and is wearing one of her wristbands. And, and this is a way to help her get better at tracking her own health and using that data to bring that into clinic. So I don't have any candy or chocolates or other things, but hopefully, and I didn't put smartphones in everyone's bag, but hopefully you all have one, and I would encourage you to search for the ASCVD under the App Store. It should work on any smartphone. One of the beauties of mobile devices is the ability to learn a lot more about your own health. And used to be that, it wasn't until you were in the doctor's office that you could do your own risk score. And actually one of the sad things is because it's a little bit complicated, it's not just a quick lookup, most doctors don't do this. So it's actually probably more likely that you will do it than your doctor will do it. But you have the ability, you do have to know your total cholesterol and your HDL and your blood pressure. But then you can get what's your 10-year risk. So that works if you're at least age 40, it'll do a 10-year risk. If you're at least age 20, it'll give you a lifetime risk. And you can also run it on your family members because I think sometimes they're not always as engaged as you may be in wanting to help their health. And the Heart Association is very involved in this. It has the Simple 7, so those are the key things when we were talking about risk factors. So being active, eating better, watching your blood sugar, blood pressure, no smoking, and cholesterol and weight. And they have both a website, so what they can do your My Life check there, or they will be coming out with a mobile Heart 360 coach. So I think we're in this very exciting time in this field. So, of course, all this data doesn't get us very far unless we can modify behavior. So a big part from our side is trying to figure out how can we use this to really get people engaged to change behavior. And that's, I think, a much harder problem, and honestly, something they never taught us in medical school. So having more data doesn't always make things better. On the imaging side, we can take these great pictures, but we haven't quite done as much research as they've done, say, with mammography, to have a standard screening test for everyone. We haven't gotten there quite yet. And mobile health, as I mentioned, can it really change behavior? I think a key element here is bringing in experts in behavior change, behavior science, because doctors are not good at this. But we're trying things. We're trying to say, does bringing the data into clinic and following people between visits, will that help? And maybe the best people to talk to are either we heard about from food, the consumer industry side, or on the gaming side. Gamification of some of these apps is probably more effective at getting people to do that extra physical activity every day than thinking that your doctor just told you you're supposed to do it. So our heart under a microscope. Science is clearly giving us better microscopes to see both inside our heart and to track our activity and health. I think it's very exciting that we can empower our patients, and hopefully we can better empower our doctors and nurses and healthcare providers for a more predictive and preventive healthcare system. Unfortunately, for better or for worse, a lot still comes down to our daily choices of what we eat, how much we move, and science doesn't have all the answers to that just yet. Thank you very much.